Imagine waking in the middle of the night to a strange burning that starts in the soles of your feet and slowly climbs upward, or a constant pins and needles sensation that never quite leaves your hands. You try to shake it off, but the discomfort follows you through the day, making ordinary steps feel uncertain and simple tasks like buttoning a shirt suddenly frustrating. For many people past 40, and especially those living with blood sugar challenges or the quiet wear of years, this is the beginning of peripheral neuropathy, a condition in which the nerves that carry signals between the brain, spinal cord, and the rest of the body become damaged or irritated. The pain, tingling, numbness, or weakness can steal sleep, limit movement, and quietly erode confidence. Yet emerging research and clinical experience point towards certain vitamins and supportive nutrients that may help the body protect and, in some cases, begin to restore healthier nerve function, especially when deficiencies or high oxidative stress are part of the picture. If the sensations in your feet or hands have begun to change the way you move through ordinary days, take a moment now to like this video and subscribe to Health Journey. These conversations reach thousands of people searching for practical, science-grounded hope, and your support helps keep the guidance coming. Peripheral nerves are delicate messengers. When they are healthy, they transmit sensation and movement with quiet precision. When they are under strain from high blood sugar, inflammation, nutritional gaps, certain medications, or the cumulative effects of aging, the signals become distorted. Burning, stabbing, or electric sensations appear. Numbness can make the ground feel distant under the feet. Weakness may follow. The longer the stress continues, the more the protective covering around the nerves, called myelin, can suffer, and the more the nerve fibers themselves struggle to carry clear messages. The hopeful side of this story is that nerves possess a remarkable capacity for repair when the right conditions are restored. Certain vitamins play central roles in that repair process, acting as cofactors in energy production, myelin formation, and the reduction of the oxidative stress that damages nerve tissue. Understanding this process can transform the experience from one of helpless endurance into one of informed, stepwise care. Many people find that simply learning the names of the nutrients involved and the ways they support nerve tissue already softens the sense of mystery and fear that so often accompanies the first symptoms. The knowledge itself becomes a form of quiet power. One of the most studied nutrients in this area is vitamin B12, also known as cobalamin. This vitamin is essential for the production and maintenance of myelin, the insulating sheath that allows nerve signals to travel quickly and accurately. When levels fall too low, the sheath can thin or become damaged, leading to the classic symptoms of tingling, numbness, balance problems, and even cognitive changes. Older adults, people taking metformin for blood sugar control, those who have had bariatric surgery, and individuals following strict plant-based diets without careful supplementation are especially vulnerable. Research has shown that restoring adequate B12, particularly in the active methylcobalamin form, can improve nerve conduction and reduce neuropathic symptoms in many people who are deficient. Blood testing is the only reliable way to know where levels stand, and working with a doctor ensures the right dose and form are chosen. Some individuals respond best to oral supplements. Others need injections when absorption is impaired. The improvement is rarely overnight, yet over weeks to months many notice the burning lessens, and sensation begins to return in small but meaningful ways. Pairing supplementation with consistent blood sugar management often amplifies the benefit, because high glucose continues to stress the same nerves that B12 is trying to support. Regular follow-up testing helps confirm that levels are rising into a healthier range and that the chosen form is being absorbed effectively. Some people also discover that addressing B12 improves not only the feet and hands, but a subtle mental fog that had been present for longer than they realized. Closely related is vitamin B1, thiamine, and its more absorbable form called benfotiamine. Thiamine is critical for the way nerves generate energy from glucose. When blood sugar runs high for long periods, certain toxic byproducts accumulate and injure nerve tissue. Benfotiamine appears to help the body process those byproducts more safely, reducing the damage. Clinical trials in people with diabetic neuropathy have reported reductions in pain and improvements in nerve function scores after consistent use. The fat-soluble form reaches nerve tissue more effectively than ordinary thiamine, which is why it has received particular attention. Again, this is not a standalone cure, but for many it becomes one supportive piece of a larger strategy that includes blood sugar management and overall nutrition. Some people find that taking benfotiamine with a meal that contains a little healthy fat improves comfort and consistency. Over time, the cumulative effect can be a noticeable softening of the constant background discomfort that once dominated the evenings. The change is often gradual enough that one day a person simply realizes the burning no longer wakes them as frequently. Vitamin B6 requires a more careful conversation. In the right amounts, it supports neurotransmitter production and nerve health. Deficiency can contribute to neuropathy, yet excessive long-term intake, especially above 200 milligrams daily for extended periods, has been linked to sensory nerve damage of its own. The lesson is balance. Most people obtain enough B6 from food, and supplementation should be guided by testing and professional advice rather than high-dose guesswork. A balanced B complex that includes modest amounts of B1, B6, and B12 is often preferred over isolated high doses of any single vitamin. Food sources such as poultry, fish, potatoes, and bananas can contribute meaningfully without the risk that comes from megadoses. Checking labels carefully and staying within recommended ranges protects the very nerves a person is trying to support. Awareness of this balance prevents well-intentioned efforts from creating new difficulties. Vitamin D has also emerged as a meaningful player. Low levels are common, and several studies have associated deficiency with greater severity of neuropathic symptoms. Vitamin D supports nerve growth factors, reduces inflammation, and appears to improve pain scores in some people with diabetic neuropathy when levels are restored. Simple blood work can reveal status, and supplementation under guidance can bring levels into a healthier range. The same sunshine that lifts mood also helps the body make this vitamin, yet many adults, especially those who spend most of their time indoors or live in northern climates, still fall short. Combining sensible sun exposure with dietary sources and, when needed, a carefully chosen supplement often produces the most reliable results. Some individuals notice that once vitamin D levels rise, sleep quality improves as well, creating a secondary benefit that further supports nerve repair. The connection between better sleep and reduced pain sensitivity becomes another quiet advantage of restoring this nutrient. Alpha-lipoic acid is not a vitamin, yet it is frequently discussed alongside them because of its strong antioxidant properties and its ability to regenerate other antioxidants such as vitamin C and E. Multiple trials have shown that oral doses around 600 milligrams daily can reduce burning, tingling, and pain scores in diabetic neuropathy. It appears to improve blood flow to the nerves and lower the oxidative stress that drives ongoing damage. Many clinicians include it as part of a comprehensive approach when symptoms persist despite good blood sugar control. Taking it consistently, often with food, helps minimize any stomach discomfort some people notice at the beginning. The antioxidant support it provides can complement the myelin-building work of the B vitamins, creating a broader protective effect. For some, the combination of these nutrients becomes a foundation that allows other lifestyle changes to produce clearer results. These nutrients do their best work when the larger environment supports them. Keeping blood sugar as steady as possible reduces the constant chemical stress on nerves. Gentle movement improves circulation to the extremities and can ease the sensation of tightness or heaviness that often accompanies neuropathy. Avoiding smoking and limiting alcohol removes two additional sources of nerve injury. A diet rich in colorful vegetables, quality proteins, healthy fats, and adequate fiber supplies the building blocks nerves need while helping stabilize glucose. Sleep that is long enough and consistent allows repair processes to occur. Stress management matters too, because chronic tension can amplify pain signals. None of these steps require perfection. They require consistency and patience. Small daily choices repeated over months create the conditions in which vitamins and supportive nutrients can exert their greatest effect. Some people find that preparing a simple evening routine that includes a short walk, a glass of water, and the day's supplements becomes a quiet ritual of self-care rather than another task to remember. Others notice that the same habits that support the nerves also improve energy and mood, reinforcing the motivation to continue. Warning signs deserve attention: sudden weakness, rapidly worsening numbness, difficulty walking, bladder or bowel changes, or symptoms that appear after starting a new medication should prompt medical evaluation without delay. Neuropathy can sometimes signal an underlying condition that needs specific treatment beyond vitamins. A thorough history, examination, and selected blood tests can clarify the cause and guide the most effective plan. Self-supplementation without understanding the full picture can miss important issues, or, in the case of high-dose B6, create new problems. Working with a knowledgeable clinician turns guesswork into a clear, personalized strategy. Early evaluation also offers the chance to address reversible factors before more lasting damage accumulates. Many people later express relief that they sought guidance sooner rather than later. Consider the experience of a man named Thomas, 62, whose feet had burned so intensely at night that sleep became fragmented and daytime energy suffered. After blood work revealed low B12 and borderline vitamin D, he began a carefully supervised regimen that included methylcobalamin, vitamin D, and alpha-lipoic acid alongside tighter blood sugar habits and short daily walks. Over 3 months, the nighttime burning softened. Sensation in his toes improved enough that he no longer felt he was walking on cotton. He still manages the condition rather than claiming a complete cure, yet the difference in daily comfort and confidence has been profound. Stories like his remind us that nerves can respond when the right support arrives and the damaging pressures are reduced. Thomas also discovered that simply knowing the name of what he was experiencing and having a concrete plan reduced the anxiety that had once amplified every sensation. His wife later shared that the improvement in his sleep and mood had quietly improved the atmosphere of their evenings together. The ripple effects of better nerve comfort often reach farther than the feet and hands alone. The emotional cost of neuropathy is often underestimated. The constant background of discomfort can lead to irritability, isolation, and a quiet fear that mobility or independence will continue to decline. Partners may struggle to understand why simple activities become difficult. Naming the problem, seeking clear information, and taking stepwise action restore a sense of agency. Many people discover that once the physical symptoms begin to ease, the emotional weight lifts as well, creating space for renewed engagement with the people and activities that matter. Conversations that once felt awkward become easier when both partners understand that the sensations are real, measurable, and often improvable. Support groups, whether in person or online, can also provide a sense of shared experience that reduces the isolation many feel. Knowing that others have walked a similar path and found meaningful improvement can itself become a source of steady encouragement. If the sensations in your feet or hands have been changing, or if you have already begun exploring nutritional support, I invite you to share your experience in the comments. What has helped, what questions remain, or what encouragement would you offer someone just starting this path? Your words may give another viewer the exact insight or hope they need today. And if this conversation has been useful, consider sharing the video with a family member or friend who might benefit. Knowledge offered with care can become a quiet gift that travels farther than we realize. Nerves are resilient when given the chance. The vitamins and supportive nutrients we have explored are not magic, yet they form part of a practical, evidence-informed approach that many people use to protect and gradually improve nerve function. Combined with steady blood sugar management, movement, nourishing food, and professional guidance, they offer a pathway toward greater comfort and confidence. May this understanding serve as a steady companion on your own health journey, reminding you that small, consistent choices can still make a meaningful difference even after the first signs of nerve strain have appeared. The body continues to respond to care, and the possibility of feeling more at ease in your own feet and hands remains open. Progress is often measured not in dramatic, overnight changes, but in the quiet accumulation of better nights, more confident steps, and a renewed sense that the body can still heal and adapt. In the end, the most powerful shift is often the decision to treat the nerves with the same patience and consistency one would offer any other valued part of life. The journey toward greater comfort is rarely linear, yet each supportive choice adds another layer of resilience, and over time, those layers can change the way the body feels and moves through ordinary days.